See that liquid coming out of there?
Yeah.
That's her joint fluid. Hey guys, Dr. Colton Ramps from here at Epic today. Looking at this little junior rodeo 4-horse here. Got a young lady that rides it, does barrels and poles. Pre-purchase exam was done about a year ago by another vet. They found some Hock Arthritis, mild, but didn't think it would be too much of an issue, and it hasn't been, but she is starting to get a little bit sore. They're noticing a little bit of decrease in performance, occasional swelling, soreness in the hocks. So brought her in for performance eval. We did an ultrasound on that right hind because that's where she had developed a little bit of swelling. Soft tissues all look good. There is some arthritis in there. Yeah, she does have a little arthritis though. Her joints are starting to get a little bit tight. Quite a bit of back pressure on there. I'll be interested to see what those x-rays look like. On these, I don't like to overfill them, so we'll just go about. So managing our arthritis, you got a lot of different ways to do it. You can, go straight into the joint with a corticosteroid, cortisone, like we did on her today. You can use regenerative products like a PRP or stem cell, Renovo. There's a lot of great options that we have right now as far as actual intra-articular in the joint therapies. Another one would be Arthramid or Ultrax, so some of the kind of thick gel-like products. So we can both modify the disease with some of those and also address some of the kind of clinical manifestations or the problems that they get secondary to that arthritis. Pain, inflammation, swelling, decreased performance, all that stuff. Systemic joint supplements or joint treatments like a Penisan or an Adequan or a Legend, something that's going to improve your cartilage health, joint fluid health, all those things are great options. Some older horses, we just put on some non-steroidal anti-inflammatories, just, some good old Equiox or Butte when they are going to be rim hard, just to make them feel a little bit better. So a lot of options. We decided that some steroid injections would be a great plan for her. So that's what we did. Some low-dose cortisone. She should be feeling great. $1 million, back to running around barrels and having a good time with her little rider.